Hey, Tom, I'll just comment briefly. You said, I know we got to go to Q&A. You said Project Play has made such a difference. But with COVID, we have a new reality ahead. There are 150 or so YMCAs that are going to close nationally. We've had thousands of pools close over the last couple of decades. And with municipal budgets tightening as they will, we're going to watch continued reductions in parks and recreation budgets that may take us backwards very quickly. So these initiatives and things that we're talking about today, I think couldn't be more urgent and important for us to be working at the community level to activate than they are now, because we're going to watch a slide in access. It's just the result of the economy.
Just it's really an argument for taking a systems approach, applying the principles of collective impact, following the data. Yeah, we need that more than ever now.
Yeah.
Great. Thank you all for such an engaging set of presentations. We've got a few minutes that I want to use to get to a few questions that have come in from the audience. So one question really kind of deals with some of the equity issues that I think all of you, generally highlighted briefly in your discussion, but I'd like to get your thoughts and maybe at a little bit deeper level. In these types of instances, you mentioned that sport can be used as a way to sort of distinguish haves versus have-nots. I think Tom mentioned the travel ball example. Dev talked about facilities and investment in facilities and communities. How do you use modeling in your conversations with your stakeholders, really kind of guard against the use of this type of approach from becoming something that further exacerbates differences and disparities?
I can speak that at the municipal level, we discussed the number of kids who are on free or reduced lunch as a baseline objective for who we want to create access to. And it becomes a very ambitious challenge for that community, but it also highlights where the disparity really exists. And so we use, that's where we start. And so we begin there. And that's the data that we're applying when we think about access. Our objective is to create access for kids and to sponsor the same number of kids who are on free and reduced lunch into sport, recreation, activity. Does the budget support that objective?
Mm-hmm. And Jamy, that's why it's important to do systems modeling as opposed to maybe broad brush. I mean, it's important also to look for general trends, and correlation studies and association studies are useful. But when you want to develop a model to really tackle a problem like this, you have to look at individuals and what their situations are and what the systems are around them. You're not going to have the same situation for someone in a certain neighborhood in a certain social economic system versus another. So therefore, that's the reason why we explicitly give each of these agencies different types of characteristics and also model what's around them. Because as we know, these health issues, obesity, et cetera, is not an individual problem. It's a systems problem. And then we have to represent those systems that are affecting the individual and preventing the individual from physical activity as well.
Yeah, Jamie, I would add, from our perspective, what we try to do is just make people aware that there are gaps out there. So that's really a two-step process. That's capturing the data. So we know that kids who from homes of $25,000 or less play sports at half the rate as kids from $100,000 or more. And we track it on an annual basis. But then we also have, we make very intentional efforts to reach out to major media organizations to make sure they know about that data and they create storytelling around it. We try to connect them with, localized themes so they can take that number and flesh it out a bit. And so we tried that, by doing that, we've really tried to get access to sport on the national agenda. And I think it's there. I think people understand that. But without that data point, people just assume, well, kids play sports. Everybody plays sports. So a two-step process. And then our PSA campaign, the Don't Retire Kid, had a strong theme of the kids who are left behind. Like, making the travel teams great, but you can't, now you got to tell your kid you can't afford to move forward with it. So you got to be intentional about it.
So speaking of that intention, are you all able to look at a community level and sort of identify, this is coming from the audience, identify specific communities that you can highlight that are, low income communities with high percentages of health disparities that have seen benefit as a result of the Project Play?
Yeah. So, we've worked in Harlem. So for instance, we went in and we landscaped the state of play in Harlem. We talked to kids. Ask kids what you want. Remember, that's the play number one. So it's hard to do. We got surveys into all the schools and said, hey, what are you playing? And what do you want to play? And what do you know? In this, community, East Harlem, 51% Latino, these kids, a lot of them wanted to play hockey. Like, and the NHL didn't know that, and Madison Square Garden and the Rangers didn't know that. They saw that data and said, okay, this is great. So then we put them together with the schools there, and they got floor hockey into many of the schools in East Harlem. A very low cost way to kind of touch the game. So there have been activations like that, throughout in Detroit. Hockey again. It was we made them aware that you're called Hockey Town, but fewer than 1% of kids in the actual city of Detroit play the game. So what can you do about that? And what do you know? The NHL and the Red Wings, working with other partners, put together $1 million program. And they're going to get to get floor hockey into schools and other forms of hockey. So tens of thousands of kids are going to touch the game in some form or another in the coming years. So they're all little activations like that happening in the different communities where we and our partners have been working.
I can give an example as well, and again, inspired by Bruce and Tom. In Rocky Mount, North Carolina, we opened what's called the Rocky Mount Event Center. The debate in the town was whether you put it in downtown, which at the time was a blighted downtown, or you put it out in the suburb close to hotels, et cetera, et cetera. But we used a federally qualified census tract to allow the project to qualify for new market tax credits. We put a federally qualified medical partner in so that now over 1,800 women a year, I believe, have mammographies that otherwise would not have. And this center is a couple of blocks from the neighborhoods that are most in need of this center. We then put an access program in the facility that is sponsored by a blend of the city and corporate sponsors. And it's this collection of strategies around site selection, census tract, federal incentive, and the capital stack, including the partners with the qualified medical partners that really allowed that project to come to life. And if you took any one of those components out, it would not work. And it really required data that was the result of prior work on census, systems modeling data around that census tract, those neighborhoods, which kids get access to what. So that's one example.
Well, this is great. Unfortunately, we're going to have to go ahead and call this session. But based on the number of questions that are coming in, people are certainly very engaged. And I'm going to say you all have set the bar fairly high as a starting point for the day. So thank you all for really engaging presentations. Thanks to the audience for great questions. We're going to take a break and resume at 11:45. Thank you all.